Stoic Practices for Mental Health Awareness. In the modern world, mental health awareness is more critical than ever. With increasing rates of anxiety, stress, and mental illness, finding effective strategies to improve mental well-being is essential. One ancient philosophy that offers practical wisdom for mental health is Stoicism. Rooted in the teachings of philosophers like Seneca, Epictetus, and Marcus Aurelius, Stoicism provides valuable tools to manage anxiety, reduce stress, and promote overall mental health and well-being. This article explores Stoic practices that can transform mental health and offers insights into how they can be applied in today's context. Understanding mental health. Before delving into Stoic practices, it's essential to understand what is mental health. Mental health encompasses our emotional, psychological, and social well-being. It affects how we think, feel, and act, influencing how we handle stress, relate to others, and make decisions. Mental health is not merely the absence of mental illness. It's about having a positive state of mental well-being where one can cope with the normal stresses of life, work productively, and contribute to their community. The connection between Stoicism and mental health. Stoicism, an ancient Greek philosophy, emphasizes rational thinking and self-control. Stoics believe that we cannot control external events, but we can control our reactions to them. This fundamental principle aligns closely with modern psychology, particularly cognitive behavioral therapy, CBT, which focuses on changing thought patterns to influence emotions and behaviors. Key Stoic practices for mental health. 1. Dichotomy of control. One of the core tenets of Stoicism is the dichotomy of control. This principle teaches that some things are within our control, our thoughts, actions, and reactions, while others are not, external events, other people's actions. By focusing on what we can control and accepting what we cannot, we can reduce anxiety and stress. For instance, instead of worrying about a stressful event at work, Stoics would focus on preparing themselves to handle whatever happens with equanimity. 2. Negative visualization. Negative visualization involves imagining possible negative outcomes to appreciate what we have and prepare for challenges. This practice helps build resilience and reduces fear of the unknown. By contemplating potential difficulties, we become mentally prepared to face them, making real-life challenges less daunting. This technique can be particularly useful for anxiety relief, as it allows individuals to confront their fears in a controlled manner. 3. Mindfulness and present moment awareness. Stoics emphasize living in the present moment, akin to modern mindfulness practices. By focusing on the present, we can reduce rumination about the past and anxiety about the future. Mindfulness involves paying attention to our thoughts and feelings without judgment, which can improve our mental health and well-being. This practice helps us to remain grounded and centered, reducing the impact of stress and anxiety. 4. Self-reflection and journaling. Self-reflection is a critical component of Stoicism. Stoics advocate for daily self-examination, where individuals reflect on their actions, thoughts, and emotions. Journaling is a practical way to engage in this reflection. By writing about our experiences and evaluating our responses, we can gain insights into our behavior and make conscious efforts to improve. This practice is beneficial for mental health as it promotes self-awareness and personal growth. 5. Virtue and character development. Stoics believe that living a virtuous life is essential for happiness and mental well-being. Virtues like wisdom, courage, justice, and temperance guide Stoic practice. By striving to develop these qualities, individuals can create a strong moral character, which serves as a foundation for handling life's challenges. This focus on personal development and ethical living can transform mental health by fostering a sense of purpose and direction. Applying Stoic practices to modern mental health challenges. 1. Anxiety and stress. Anxiety and stress are prevalent issues in today's fast-paced world. Stoic practices like the dichotomy of control and negative visualization can help manage these conditions. By accepting that we cannot control everything and preparing for potential setbacks, we can reduce the impact of stressors. Additionally, mindfulness practices can help calm the mind and reduce anxiety. 2. Mental illness. While Stoicism is not a cure for mental illness, its practices can complement professional treatment. For example, cognitive reframing, a technique used in CBT, aligns with Stoic principles. By changing our thoughts about a situation, we can alter our emotional response. This can be particularly helpful for conditions like depression and anxiety. It's essential, however, to seek professional help for mental illness and use Stoic practices as a supportive tool. 3. Suicide prevention. Suicide prevention is a critical aspect of mental health awareness. Stoic practices can contribute to this by fostering resilience and a sense of purpose. The Stoic focus on virtue and personal growth can provide individuals with a framework for finding meaning in life, even amidst difficulties. However, it's crucial to emphasize that professional help and support networks are vital in preventing suicide. 4. Overall well-being. Stoicism promotes overall well-being by encouraging a balanced approach to life. By focusing on what we can control, practicing mindfulness, and striving for personal growth, we can enhance our mental and physical health. This holistic approach aligns with modern perspectives on well-being, which emphasize the interconnectedness of mental, emotional, and physical health. Transforming mental health through Stoicism. Integrating Stoic practices into daily life can lead to significant improvements in mental health. These practices encourage self-awareness, resilience, and a proactive approach to challenges. Here are some practical steps to incorporate Stoic principles into your routine. Practice mindfulness. Incorporate mindfulness exercises into your daily routine. This could be as simple as taking a few minutes to focus on your breath or engaging in mindful walking. Mindfulness helps you stay present and reduces the impact of stress. Apply the dichotomy of control. When faced with a challenge, remind yourself of the dichotomy of control. Focus on what you can control and let go of what you cannot. This shift in perspective can reduce anxiety and empower you to take meaningful action. Strive for virtue. Identify the virtues that are important to you and make a conscious effort to embody them. Whether it's courage, wisdom, or justice, living by these principles can provide a sense of purpose and guide your actions. Conclusion: Stoicism offers timeless wisdom for enhancing mental health awareness and well-being. By integrating Stoic practices into our lives, we can develop resilience, manage anxiety and stress, and foster a sense of purpose. While Stoicism is not a substitute for professional mental health treatment, it provides valuable tools that can complement modern psychological approaches. By embracing Stoic principles, we can transform our mental health and live more fulfilling lives. Understanding and applying Stoicism requires practice and commitment, but the benefits are profound. As we navigate the complexities of modern life, Stoic practices can offer a steady anchor, helping us to remain grounded and focused on what truly matters. In doing so, we can cultivate a healthier, more balanced approach to life, improving our overall mental health and well-being.